healthcare disparities too often leave the most vulnerable behind, they are those who rise to bridge the gap between compassion and care. One of such transformative efforts is the Rhythm of Compassion Network Benefit Music and Art Concert, a bold initiative aimed at raising vital support for indigent patients at the Jos University Teaching Hospital, Juth, Plateau State, Nigeria, through the power of music, arts, and community engagement. Now, there are lots of persons at the forefront of this movement, and in this interview, we will get to meet some of the great persons behind this wonderful initiative. And now we get to meet one of the great people behind this. So let's get to know you, sir. Let's get to meet you. Can you briefly share with us who you are and how you are engaged in this initiative?
All right, thank you very much, Zoe. I'm Dr. Pokop, the Chief Medical Director of Jos University Teaching Hospital. I'm saddled with the day-to-day running of this institution, and by virtue of that, I see requests coming from patients that cannot afford to pay their bills. I see requests for waivers, and so when this initiative came by a group of individuals, some of them are staff, they have a group called the Rhythm of Compassion Network. And said they would like to have a concert to raise funds to support indigent patients who cannot afford to pay for their bills, their hospital bills in the hospital. And I felt that was a very brilliant idea and initiative that should be supported by the management of Jos University Teaching Hospital. And then, of course, we have the League of Friends of Juth. They have been in existence for decades now and for years, and they've helped, to pay the bills of indigent patients. So that is what drove some of us to buy into this idea and initiative.
All right. So, as the CMD of Juth, how serious is this issue of indigent patients at Juth?
Well, it's very serious. In Jos University Hospital, like I said earlier on, I see requests for waiver. I've seen reports from the medical social works where patients have been discharged, but they couldn't pay their bills, so they stay in the wards for extra days, sometimes weeks, and sometimes months. So the medical social works department, tries to reach out to public spirited individuals through the League of Friends of Youth and through community leaders, opinion leaders, sometimes churches, mosques, and philanthropic organizations to assist in paying the bills of some of these patients, and sometimes reaching out to the relations that they feel can assist and all that. So I see those reports and then get those requests. So it tells me that it's a very serious challenge, and more so with the economic situation that we find ourselves as a nation. Uh, Things are difficult with people, so that is the reality that we see, and so it's increasing the number of those that cannot afford
Yes,
those
indeed.
services.
All right. So, is this a religious or a political event?
Not at all. Not at all. I mean, sickness, poverty, lack does not know religion, does not know tribe or creed or anything. No, it's not at all. It's just human beings trying to help fellow human beings. It's the humanity in us that God has created in us to have compassion. That's why the network is called the Rhythm of Compassion Network, and it's really out of compassion for fellow human beings You don't need to know them. You don't need to know whether they're Christians or Muslims or idol worshippers or what's their tribe. No, but that they are created in the image of God. They are human beings, fellow human beings like us that need help. So why not? I mean, that's why we feel this is a very great initiative that that brings out the humanity in us and the compassion that God has created in us.
All right. All right. So let's begin to look at some other aspects of this. What do you hope to see after this concert? And is it going to be a one-off, like a one-time event?
Well, I don't see it as a one-time event. As the need arises, I believe the compassion is not a one-time event. Is something that you want to see it sustain.
So, what role do you think the public can play moving forward, counting down to when the event, the concert will take place?
Very big role. I mean, crowdfunding. You know, by attending the concert and by even donating, you don't have to. If you're unable to come physically, you can donate. I'm sure there will be an account where the public can donate is crowdfunding. So the public, the general public, the society will have a very big responsibility. So don't say, "Oh, I don't have enough. I don't have too much." No, there's no amount that is too little to be given. Like I said, it's crowdfunding. If you have 1 naira, please give your 1 naira. It will help somebody. 10 naira, 5 naira, 500 naira, 1,000, 2,000, 10,000, 50,000, 1 million, 100 million naira, 1 billion naira. Why not?
Wow.
It's for humanity. So everybody can contribute, to this. So the general public, I encourage to, key into that, to follow and track this, and keep a date with the Rhythm of Compassion Network to be a part of it.
All right. Now, talking about the funds that will be raised, also, when you look at another aspect of it, how is this going to help Juth in the long run? Will it help to reduce mortality rates?
Definitely, because sometimes some of those indigent patients cannot afford certain either medication because they don't have the resources, or um, investigations to be done they don't have, you know. So it would definitely impact on the outcomes of the patients that access here in Jos University Teaching Hospital. And so again, it will help the hospital in recouping the resources we put in there in terms of the consumables, and to be able to take care of some of our needs to keep the hospital running, because without, patients paying, we will not be able to generate to sustain, the hospital.
The quality healthcare that
And
we get.
exactly, so we have to pay for it. So even also, I mean, would have been waiving the bills out of compassion, but if we keep waiving, there won't be a hospital for any of us to come and access healthcare from.
Absolutely.